So my name is Mamata Majmundar. I'm a family medicine physician by trade, have over close to 25 years of experience in the healthcare industry. I started out in a physician multi-specialty group as a partner, really doing ambulatory and urgent care, getting to see what it's like as a provider. From there, I spent time working in a federally qualified health center and a community health center, did a lot of work with refugees as well as infants, working with unhoused individuals as well as people that had difficulty with substance use disorders. And during that time, I also spent doing a lot of work with nonprofits as well as organized medicine, working with policy change from a healthcare and patient perspective that's there. And then the last 5 years I've spent on the payer side. I was with Aetna CVS Health as a medical director for the Medicaid line of business. We served over 650,000 members in multiple states. And then recently, over the last 3 years, I was with a startup insurance company, which was pretty exciting. I think I've always known that I wanted to be a physician. Growing up in a household of physicians, actually I grew up with my parents' practice in the basement of our home. And I knew from middle school on, that's the path that I wanted to take. It was a very unique experience. It helped me understand the dedication and the desire to want to be a physician and give back. I did it because I was passionate about it. And I think that's what keeps me continuing to be in that type of role and setting in healthcare. I heard about AAPL probably in the mid-2010s. Actually, a colleague of mine, I was discussing with them, I was looking at ways how I could increase my skill set as a leader. Talked to someone who had been part of the organization, had gone through the Certified Physician Executive course, and that sparked my interest in it. This gave me an opportunity to go and check out a course. I could decide from there if I wanted to pursue something further, which gave me a lot of flexibility, and a lot of programs aren't like that. So it was a minimal investment in my time as well as financially, and it was just an amazing event for me. Once I took one course, I wanted to continue and get my Certified Physician Executive. So when I started taking courses with AAPL, what I noticed in terms of how it was different than my other formal education is AAPL gave me things from a perspective of not only a physician, but a physician within healthcare in the entire industry. I also was able to meet with physicians that were experiencing the same challenges that I was having. So being in person and working with other physicians, you had an outlet. I was able to continue to build upon the initial courses that were in place, which continued to help me realize how I could use it in different areas. What I grew up in is direct clinical care. That's what I was exposed to. That was my environment. And when I came to AAPL, I met physicians not only within my specialty, but in other specialties. And I could see that they were doing things that were different, whether it was direct clinical care, administrative work. Then I met physicians that were doing things outside of direct clinical care. And that really sparked my interest. How could I use my clinical skill set and my leadership skills to do something in another realm in the industry? What AAPL taught me were fundamentals: communication, negotiation, resolution of conflict, and those can be translated into any industry that was there. I'm a very mission-driven, purposeful person. I enjoy arts. I enjoy reading. I love trying new restaurants, meeting new people. I love spending time with my dog and my family. I love to travel. AAPL will help you with change management, how to manage your feelings to embrace change, because change always occurs. It will also help you in terms of conflict resolution, because what will occur is, as a healthcare leader, you are going to be working with administration as well as maybe people under you or your peers. And you'll have to determine ways and solutions on how to take this advanced technology and make it work for your system. Because what works for my system in Kentucky may not work for your system in Minnesota. So AAPL gives you those foundational skills, and then you can take that and go any place within your industry.